Hey everyone, thanks so much for joining us. I'm Dr. Marinelli. I'm joined by a few awesome medical students here. We just started, it's just 8 o'clock Eastern on the dot, so we will give everybody a couple minutes to log in. We were just kind of bantering back and forth about medical school, so we'll probably do that for a couple minutes while we're waiting for people to join the room. And then we'll start with introductions and go into what it's like to be a scribe. So while we're waiting, actually, let me ask you guys. So let's start with Thomas. Thomas, how long were you a scribe?
5 years, I think.
Wow.
Oh my gosh.
Wow.
6? Too long. Whenever people ask me how long I was a scribe, too long is the answer I go with.
All right. That's fair enough. Thomas, thank you. Justin, how about you? How long were you a scribe?
1 year.
1 year.
Yeah, for a gap year. So in and out.
Cool. Melissa?
All right, this is where I'm going to show my age. I was a scribe for 8 years.
Wow.
All right.
I was actually the second batch that was hired when ProScribe was founded in 2010. So here we are.
Oh, wow.
Yeah.
It's amazing.
Well, let's get started. Let's not delay anymore because I want to continue this conversation. So for everybody that's just joining us, my name is Dr. Marinelli. I am a primary care physician, and I also work as the director of advising with MedSchoolCoach. So I've worked a lot with ProScribe over the last several years, and I've seen and really worked with a ton of scribes, and I've noticed scribing has become much, much more popular among pre-meds and the like. And so I think this webinar is super important for people that are out there thinking about becoming a scribe or scribing now and how they can really use this to their advantage. Let's start. I know that you kind of just gave a little tidbit of an introduction, but Melissa, you want to introduce yourself?
Yeah. Hi, everyone. My name is Melissa Estrada Gannon. I'm currently second year at UTRGV. That's Rio Grande Valley, down in the tip of Texas along the border. A little bit about me and my background. I am actually the very proud daughter of 2 Mexican immigrant parents, first generation college attendee and graduate. I got my bachelor's of science in bio, my post-bac in mortuary science, and I actually am a provisional licensee dual for embalming and funeral directing. And I worked for 8 years with ProScribe, and the first 4 were at all the Baptist hospitals in San Antonio. The second set of 4 years was at University Hospital, directly tied to UTESCA. So very nice to be here, and thank you for having me.
What a background.
Yeah.
All over the place.
Yeah. Justin, how about you?
So my name is Justin Alicea. I am from New Jersey. I live in Jackson. I'm a second year medical student at Rutgers Robert Wood Johnson Medical School in New Brunswick. I went to Cornell University for undergrad, majored in psychology, minored in Spanish, and then took a gap year, worked as 1 year as a scribe. In Central State Hospital in Freehold, New Jersey, in neurosurgery. And and now just chugging along through medical school. I don't have as amazing a background as you do, Melissa. That's awesome.
We might just ask you to leave in a little bit.
Yeah.
I don't know what you say for a while.
Yeah.
Thomas, how about yourself?
Yeah, so my name is Thomas Schultz, and I'm from San Antonio. I went to Trinity University for undergrad, did biology and economics, worked for ProScribe for 5 years in the Baptist system, eventually ended up running that. Along the way, got a graduate degree in cellular and structural biology from UT Health Science Center in San Antonio, and now I'm a 4th year medical student at University of Incarnate Word School of Osteopathic Medicine in San Antonio. I applied about a bazillion times and did everything wrong until I finally did it right.
Same. Yeah.
Hopefully I can provide a little guidance on that.
Oh, yeah.
Awesome. Thomas, what specialty are you applying to this year?
Applying family medicine.
Awesome.
Nice.
Definitely love family medicine. Nice job.
That's one of my top choices, I think. I'm only second year. I don't know what I want to do yet, but I've always wanted to work with kids. And then for my first year, I had to go shadow a doctor in a family med practice. So I went 4 times, and that just put that on my radar also.
Yeah, I joked for a long time that rural family medicine was my like worst case scenario. Like, well, if all else fails, like rural family practice. Till I did it, and then I loved it, and now I make fun of myself for saying that was my backup plan forever. And
oh my gosh,
things, and I'm like, God, I love rural family med. Who would have thought?
Wow.
Yeah, I will speak to that. I'm not practicing right now. I stay home, which has been a huge blessing with coronavirus because we have a 5-year-old, and it would have been crazy right now if I was at home. So I stay home and I work with MedSchoolCoach. But my husband, he works with MedSchoolCoach, and he is a rural medicine doctor. And I mean, rural, like as if the nearest hospital is probably close to 2 hours away. Yesterday, he saw like a kid with an arterial bleed because he cut his thumb trying to cut open an apple. He's doing today he texted me and said that he saw a wildlife biologist that had cut her hand doing a necrolepsy on a deer. So I mean, like things that you see.
Wow.
Yeah.
Oh my gosh.
And you have to get very creative too, because if you don't have the ER, if you don't have an X-ray machine or CT, you are a little bit stuck with what you got, and so you have to be creative in your care and how you treat some people. Pretty interesting. First question here: how can you use your experience as a scribe to stand out and be recognized as a strong medical school candidate? And Justin, let me throw that one to you because you had gone last a couple times or second. So let me put you on the spotlight.
Okay. So I'll start out by saying that scribing was a lifesaver for me. I was all about like the liberal arts and everything, and I did not do any shadowing throughout my undergrad. I never did it in high school. And so I was just one of those that like I would look out at all of my friends and see how much experience they had. And I was like, oh my gosh, am I cut out for this? Am I going to have to take a gazillion gap years to make up for all this time? And so as a psych major, I started doing therapy, like peer therapy and play therapy with kids. And I'm like, okay, this is something that, clinical experience. I'm working with people in somewhat of a health capacity. But I realized that, it wasn't concrete enough. It wasn't, I don't know, it wouldn't come off as believable when I was writing out the application or in an interview. When these schools want to know why I want to be a doctor, I really couldn't answer it in a believable way because I hadn't shadowed one. I hadn't worked in a hospital or a clinic setting. And so I was so happy that once I graduated and decided to do 1 gap year, that I got this scribing gig. And that is what gave me that concrete experience to refer to in essays, and especially in person. When you're put on the spot, you don't have all this time to make yourself out to have all this experience and all this like confidence. You just have to like have that ready thing to refer to. And scribing was definitely that. And I found myself in MMIs, just always referring back to this 1 year. I only have 1 year, but it provided me the answers to so many questions I was being asked, because there were so many facets to my experience, just from, the patient-doctor relationship to interscribe relationships or work as leadership positions, tons of stuff. So that's how it helped me out.
Yeah, absolutely. And I think even from an admission standpoint, they're really looking for people, like you said, that have that experience of seeing what a doctor does day in and day out. And they want reassurance that you know what you're getting yourself into. And so I think scribing is obviously a great way to do that, because you're not even just a mere fly on the wall, like in shadowing. You're actually part of the care. You're actually helping to document and helping to put all of this into a medical record and working alongside with the physician or healthcare practitioner the entire time. So that's just absolutely huge. Thomas, how about you? You said that you applied in a few times and did everything right or wrong. So was that scribing something that helped you get it right?
Well, no, scribing is absolutely something to help do it right. As he brought up, the real life experiences, and not just as a fly on the wall, but like as an active participant, I think are really valuable. Particularly once you get to that interview setting, you can really talk about how you're involved in all that you learned, because like as you're a scribe, you really learn the why behind things and the practical things, which is extremely valuable once you get into your third and fourth year. But I won't go down that. But by the way, you will be so far ahead of your classmates that don't scribe, like you have no idea how far ahead you'll be. It's huge.
Agreed.
But as far as like an application, is it gave you that like set of experiences, and particularly in an ER, really powerful experiences. I mean, I think back to a time where a patient, I wrote about this in one of my like kind of third essays I did for one of the schools, but it was like, you get this story where like I had a patient who came in and they were trans and they were afraid to talk about the fact that they were trans because they'd been mistreated, and they were on all kinds of therapy and they had HIV, but they were like afraid to say anything. Like, oh, I have a cough. And so we kind of stuck them in the hallway because we didn't think much of it. And they ended up dying. And I had like taken that patient's history and talked to them in person. And because of like discrimination they'd had in the past, they were afraid to talk, and that ultimately cost them their life. And it's like being able to refer back to like really powerful, real stories like that you really care about because it happened. It wasn't just something you like learned about or something, oh, I saw a doctor doing knee injection. You saw something just really powerful, and to like have that like passion come across when you talk to people, I think is one of the biggest values of scribing versus simply shadowing, is you need that volume of patience to get those real interactions where you have that like emotional connection, because that's what you need. Like they can see in your application if you just like have the stats or whatever, but they want to see, do you know what medicine is, and do you really care about it? Because you need that passion if you're going to make it through, because med school sucks. Let's just be real here. And just if you're only doing it as like a purely academic thing, you're not going to make it. You need to really care.
And I will say I loved med school. My husband and I both look back on it as like the good old days. We're like, medical school. It was so great.
Wow.
So enjoy it while you have it.
I will say that pre-med, at least in my school, totally prepared me for it. I was so scared, just everything you hear about it, and going in and doing my first year, I felt like, oh, you know what, this is pretty similar to what I've been experiencing. The difference is in pre-med, a lot of the classes I found, they were trying to weed students out. There's so many people who want to go into the medical field, and they need to weed students out, and so
organic
I felt
chemistry.
Yes,
Absolutely.
exactly.
Weed out class.
So I felt like almost like they didn't want me to succeed there, and everyone was pit against each other. And it's a total opposite experience at Robert Wood, where it's a smaller class. I know more of the students there, and we're in. So the professors, they want us to be the best that we can be. And, at least, at Robert Wood, it's pass fail for the first 2 years. So people aren't clamoring over each other to get the better grade. So it's a lot better environment, in my opinion, than pre-med was.
Yeah, agreed.
Yeah, absolutely. I would have to agree with both of y'all. At least for myself, I was very much in a similar situation as Thomas was. I actually went through 5 application cycles. And the first 2 were a complete wreck. I had no business applying, but I got caught up in the really toxic pre-med environment of, well, my friends, everybody around me is applying already. I haven't started applying. Like, what's wrong with me? I'm late. And then you develop, at least myself, I got really anxious about it. And then I was really hard on myself and very hypercritical. And you just kind of go down that rabbit hole. But I think scribing would kind of bring me back to like, okay, no, slow it down, calm down. And this is why you're doing it. This is why you say you want to do it. And this is, your passion. And so it would kind of reignite that like burst of confidence and motivation that I needed in myself, because going through rejection during application cycles, I mean, my self-esteem like vanished. My confidence vanished. And it's just, combine that with everybody around you is getting in and succeeding. And the worst experience I had was, having applied so many times, I would run into classmates that applied the same time that I applied the first time. And they were now interns. And they would, say hi to me, and very, very pleasant people, very nice and friendly people. But there was just like that shame where they'd be like, oh, so what are you doing here? Are you, doing your rotations here? And it's like, oh no, I'm still scribing. I'm still trying to get in, and there's nothing more crushing than that. But definitely being in the ER and seeing patients would always kind of remind me, like, it's okay. It's going to happen on its time.
Yeah. Yeah, absolutely. That's a great reminder. And I think probably on your side too was all of that time that you committed to scribing. 8 years.
Yeah.
I'm sure
Wow.
just love that though. I mean,
yeah,
like if you can commit to scribing for 8 years, then you can certainly commit to 4 years of medical school.
absolutely. Yeah.
Wow.
Residency you choose after that. So that's awesome.
Thank you.
Wow.
Let's move on to the next question. And Thomas, I'm going to pose this one to you first. So how do you leverage your time as a scribe to get letters of recommendation?
That's very important. Well, we'll start with that. I would do a good job. Like, honestly, you need to be a good scribe. If you're a bad scribe, they're not.
Absolutely. Absolutely.
It sounds silly, but it's not that hard, but it's also pretty hard. Just depends on the person. Some people it clicks with, some people it doesn't, but don't be discouraged. I was horrible until a doctor literally pushed me up against a wall, told me I need to either get my shit together or get out. Sorry.
Oh man.
He just retired from the Air Force and was a cranky dude, but like that motivated me. That like
I know exactly.
Yeah. So that motivated me to like get it done. And so you want to be a good scribe. You want to say that you're interested in medicine and just really like ask questions and be like, hey, I want to go to med school. If you tell them that, they will teach you so much. And if they see that you care about going to med school, these doctors want the next generation of physicians to succeed. And so they're both going to teach you, they're going to learn, they'll call people that they know for you. Don't ask, like let them offer. I mean, you gotta ask ultimately for your recommendation letter, but like build those relationships, really work on building them and just emphasize where you're going. And 2 of my letters came from doctors I worked with. So
I think that's an important point of building that relationship, like going and asking somebody for a letter of recommendation. They should never be surprised or be like, I guess I could write you one. Like they should almost be expecting it because they know you're pre-med. They've developed a relationship with you. They know how well you work and how diligent you are. So they should almost be expecting it. I think that's so important is like identifying these relationships early. And then when you go to these physicians, they're like, yes, absolutely, Thomas, I would love to write you a letter of recommendation. You've been a great scribe. That's the ideal letter of recommendation situation.
Totally.
Yeah. And that advice kind of stands across the board. I just attended an emergency medicine residency workshop just last week. And that same advice still stands. They all say nothing is worse than a generic letter of rec. And, directors can tell which ones are generic and which ones, the person, whoever wrote it, actually knows you. And it's just, for me, it was all about going the extra mile and showing interest, like Thomas was saying. That way, whenever you do apply and whenever you go through interviews, you don't tell them how much you know, you show them how much you know by sharing those experiences that you see. And I never met an attending that didn't want to teach me, didn't want, of course, all in its time, if there's, 50 people in the waiting room and things are moving fast and it's during flu season, you're not going to have time to sit there and ask questions. But any chance you get, stay a few minutes extra, ask them, is it okay if I stay after my shift just to watch that procedure? And more often than not, they'll be like, absolutely. Like, yeah. Or, once they see that interest in you, it would happen to me where they would see me on shift and they'd be like, oh, you're my scribe. Oh, great. It's going to be a good shift. And that's the kind of rapport that you want to build with your attendings, because not just professionally speaking, but, they become great mentors. And I are friends with some of the attendings and not just doctors, get to know the nurses, get to know the rest of the team, because they have so much to teach you and you have so much to learn from them. So always look beyond the physician and pay attention to the entire team and see what you can learn.
Yeah. I had an interesting experience trying to get letters of rec, being that I was only a scribe for 1 year. And on top of that, it was telescribing. So I never actually encountered the doctor. I had to look them up on the internet to know what they looked like. So it was a very interesting relationship. Thankfully, my site, we would try to get one scribe per doctor if we could. And so you can develop that relationship. And so luckily I got a very good doctor that I was comfortable with working with. And yeah, for me, it was just trying to get across, like, to develop that personal but working relationship without seeing his face, just hearing him. And within just a few months, because I started in the summer, and apparently that's when everything has to be submitted if you want to be competitive. You had to have every essay done by
the timeline,
2 to 3 weeks after you got the invite, and this and that. Please, I was still doing essays into December, and I'm not saying that's the best thing to do. I just I'm super laid back. You got burned.
I got burned by that.
Yeah.
Apply early. Don't listen to that.
I was going to
This
say,
is just my.
you have to cut that part out.
Don't do that.
But it's possible.
You know what? Yeah. And you know what though? Like summer is, there are people that submit the week that it opens, and you know what, I'm just not that type of person.
No.
And my own insecurities of writing 18 drafts for an essay, that alone is insane. So I think I submitted August and was doing secondaries in September, which is late.
That sounds amazing.
I was like,
for whatever.
I didn't until I applied on time. So
We don't recommend it.
take it for what it is.
Your chances increase if you apply earlier.
Yes.
Yeah.
Yes. But so what ended up happening?
Justin, because I think this is what you just said about telescribing. And I love that you just said that, because the next question is, what can I do as a scribe during a pandemic, COVID, to become a more well-rounded medical school candidate? So I thought I'd pose this one to you first, because there's a lot more telescribing going on right now.
Right. So it was interesting because even though it was telescribe, I was still going into the hospital. So I just never actually got the patient interaction. I was never in the room. I never saw the doctor personally, but I would go into a hospital and I had other scribes around me. I was talking to the CAs and everybody. So it's a little different. Like, I didn't have that experience scribing over, in a pandemic, but, I was thinking about this question before, and And, one of the things, if you're not scribing, if this whole pandemic has prevented you from doing that, I would just say to make sure that you're on top of current events. That was one thing that for me, I definitely still need to work on. If you got to show the school that even with everything taken away from you, you have no power to go anywhere. You're still trying to do something. You're still trying to learn. And, I think they're going to ask some sort of question on an interview, the next interview cycle, like what did you do during this pandemic? What did you learn from it? And just being able to speak on that would speak loads about who you are and how excited you are about the field. But yeah, if you're able to telescribe, then great. Like the pandemic hasn't affected you at all. Like I'm actually starting to do telemedicine. We have to do that, being first and second years, just going to patient encounters, but now it's telemedicine because of the pandemic. And I'm actually taking on extra shifts that are not required for school. I'm participating in a study just because I feel like I need the extra help. I don't want to always worry about going to see that next standardized patient or real patient. So I'm just trying to get that extra experience by taking advantage of telemedicine.
Yeah, absolutely. Thomas, how about you? Because before we went live, we were talking about how Thomas, he's a fourth year medical student, which typically during third and fourth year, for those of you that don't know, you're usually in the hospital or in clinics. Those are called your clinical years. So Thomas was just in the heart of his fourth year when kind of coronavirus pandemic really hit us hard. So how does that work? I mean, I'd love to get your perspective of how you kind of got shifted out of the hospital as a medical student. And obviously that has rippling effects on volunteers and pre-meds. If the medical student got shifted out, well, then the pre-meds aren't there too. So any insights there, Thomas?
Shockingly, the scribes actually were always still there, at least my understanding, but I digress. So for a little bit of background, I was working in the ICU doing my internal medicine rotation in March when all of the medical students across the country got kicked out. And then everybody was out for 6 weeks or so. And then we did a telemedicine elective. And so a 70-year-old man taught a bunch of 20 and 30-year-olds how to use the computer to do telemed. But we learned some good things out of that, and you get a flow. You learn what you can do over the computer, and that you can still have that patient interaction. You can still engage. You can still do an exam, shockingly, reasonably well over the computer. I think that this is another time when scribing helped me because I met a lot of doctors who did lots of exams without ever touching their patient because it was faster, not because it was the right thing to do because they were in the room and could have. But, you learn some tips and tricks on how to do a visual exam. And I think that definitely paid off on telemed. Then they brought us back for 2 weeks, and then they let us go again. And I think the importance was just if you have that time off, you need to use it really carefully. I did a bunch of board prep and rescheduled my boards actually sooner so that I could take my step 2 on time, or kind of when worked for me because of when I was home. And so I was able to get a ton of extra study time and actually did a full standard deviation better than I did on step 1, which was great because, you take advantage of the time you're given.
Yeah.
But the scribes are still there now. So, in the ER. So.
Yeah. And there's still medicine going on, even in a pandemic. And even a lot of clinics have switched more to telehealth and telemedicine. So I think, there's even more of a need for that. And we got a question out there about, so are you in a different room if you're scribing in the hospital? And it's, you're kind of, what's pretty interesting is it probably varies between practice to practice. But Justin, you were in a completely different room than where the patient and the physician were located.
Sometimes a different part of the state. I was in Freehold. They were all the way up north. Yeah. So the doctor would just wheel me in as a laptop. Sometimes they should tell the patient that I was there. They oftentimes didn't. And so when they saw the doctor talking to their laptop, they were a little confused. So I was oftentimes described as basically Siri, but better. So I would just be the laptop in the corner. It makes it difficult because, sometimes the doctor's right up to it, so it's super loud that I could barely hear the patient, and vice versa. And that's the most awkward thing, because then I have to interject, and I'm told that I can't say anything, and I have to stop what's going on, that flow, which is so important to establish rapport between the doctor and the patient. And in that time crunch, when you only have like maximum 15 minutes to see patients, I had to interrupt and say, for the sake of the note and for the sake of the patient, like, please, put me in a better position so I can hear and write a better note.
Yeah.
So yeah.
Melissa, I'm going to kind of shift a little bit, but this is still all along the same lines. Natala out there asked, are you all in virtual classrooms? And we were just kind of talking about this before we went live. So just to kind of a little bit, but still stay on this whole COVID topic and how things are changing. What's your school doing right now as far as learning?
So right now, we've been on online med school since late February, early March. And then we went for our summer break after first year. And I think it was a little unsettling because I don't even think anybody knew when we would come back. I still think that no one really knows for sure when we'll come back, when things will get back to normal. Especially with the spikes that we were seeing in Texas. And so we started online. We're supposed to go back in person partially October 1st. But the trend that we've been seeing in Texas, or at least neighboring universities, is some have had to close back down after being open for 2 weeks. So it's kind of hard to tell.
Yeah, absolutely. And definitely makes it difficult. I mean, everybody's kind of struggling in their own way right now. But definitely a different learning environment. But I will say, first year of medical school, I almost went to all live classes. And then second year, I didn't go to class a lot. Probably first and second year, it's probably not that different as going to class. Except you don't have those formal times where you get to see like your classmates and stuff, which is unfortunate. But most people don't go to class after a while. They just look online and do it. Watch online. Yeah.
If it wasn't mandatory, I stopped going to class first semester. And that's because I learned very early on that I process auditory information a little differently. So I actually had a counselor recommend me not going to class because I would go, I would spend so much time, getting ready, got to pack my lunch, then I got to get to class. And then in between class, all right, well, let's wait for the next class. And before I knew it, I had wasted hours when in reality, I wasn't actually listening as well as I should have. And so it just worked wonders for me to watch lectures at home because I could pause and rewind if I needed to. So the only thing that's different now is it's difficult having to do it from home. Because everywhere is closed, and I'm more of I need to leave my comfort of my home to be able to study most of the time. And so that's been a little difficult to adjust to, but I think I finally figured it out. So
yeah. Well, let's move on to our last kind of planned question. And I'm actually going to tackle this one first. How does working as a scribe help me become a better physician? And I've never scribed, so I can't speak to my own personal experience. But I will say, as a physician myself, I would say, one, when you're in medical school, learning medicine is like learning a different language. All of the anatomical terms, the different diseases, all of that. And I think scribes have a huge, huge advantage kind of getting exposure to that. Obviously, you're not going to learn everything. But I mean, even just learning anatomical terms like proximal and distal and the axial plane and the sagittal, I mean, you guys are getting exposure to all of this as a pre-med, and that's huge. I think that's just such a huge advantage.
Mm-hmm.
My other thing would be, probably most people don't know this going into medical school, but becoming a physician requires a lot of documentation. And, you know, we were talking about family medicine earlier, and you're going from 15-minute appointments, patient to patient to patient. You have to document a complete history, physical assessment and plan there. And you have to have a complete medical record. And if you don't, then you get in trouble from your administrators. You could get sued, and then you don't have proper documentation. I mean, there's just so many effects and so many things that depend on that medical record. And so part of what you have to learn as a medical student and a resident is how to document fast and quickly and completely. And that is hard. And scribes, you guys have a huge, 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 huge advantage learning that early on. Even just learning what goes into a complete note, what makes a complete note, what you should document, the pertinent positives, the pertinent negatives, all of those things that's a huge learning curve for medical students. And I think, Thomas, you definitely can speak to this. But Melissa and Justin, as you guys go into your clinical years, you're going to see you're probably way ahead of your peers in some of these skills that they'll have to learn. And it's a pretty steep learning curve because you have to learn it third and fourth year and pretty much master it. And then in residency, if you don't already have it down pretty well, you're going to get behind. So Thomas, do you want to shed any other insights on how scribing has helped you as a future physician?
I mean, I think you hit on the big ones right there. I mean, the big one is the terminology, what goes in a note. I mean, I'm going to be honest, some of my notes are better than some of the physicians I worked with, like in rotations, because like you're just drilled in how to write a really good one.
Yeah.
So you have that skill. I think what you actually brought up is the most important is the pertinent positives and negatives for any given complaint, because you get that pattern recognition being a scribe, you know, what are you looking for with what complaints? And I cannot tell you how many times on boards, in class, in my rotations, that I got questions right and were able to like work with my attending because I knew that I struggling to think, but we'll just say long plane rides with the PT. You know that because you marked it negative so many times as a scribe, you know they go together. And then because you asked the doctor back then, hey, like, why? You already have that leg up. So you're not thinking, you can ask the tougher questions of your attending and those like second and third order questions, because those like basic associations are already in your head.
Exactly.
It helps you move so much faster in your third and fourth year. So I think that's the biggest advantage. The other thing when I take away, I think Melissa said earlier, it teaches you to work as part of a healthcare team. And I think so many students get so caught up in just focusing on the doctor, whereas the scribes came in with this like idea of, well, there's a total healthcare team, and I'm just, as a med student, now I'm part of it. And so you're comfortable and you can work together and you can get your hands dirty. Like a concrete example of this is I was on OB and I was doing a transition. So basically I would catch the baby and make sure that they made it into the pediatric wing. And one of this very kind of old grizzled charge nurse was like, hey, where did you work before you went to medical school? I'm like, what are you talking about? I had not told you that. And she's like, oh, you talk to the nurses and you get your hands dirty. You worked somewhere. You didn't come in as a med student. And the deal is they'll help you. They will give you hints. You'll see them nodding, mouthing things over the doctor's shoulder. They'll just generally you're like part of that. Whereas I think most med students are so afraid and so focused on their attending that they miss out on that. Whereas a scribe, you spent so long as a part of that team, it's comfortable for you. And it just pays off in a lot of ways.
Yeah.
Yeah.
Absolutely.
You also get to You also get to see the type of doctor that you don't want to be. So you get to see the mistakes behind the scenes. You get to see how fatigue and just being overworked, and whether you're on nights and you did a quick transition to days or vice versa, you get to see how that impairs the judgment of the providers. And it's very different from TV medicine. I feel like medicine is oftentimes romanticized, and there's like this false perception that it's like all, you're like the cool kids in the hospital, and it's like, actually it's really not like that. And you have to go through a lot of hurdles. And I'm not just talking about application, just in general. You have to go through so many hurdles, and you get kind of beat down. It happens more often than not, where you do ask yourself, like, okay, did I make the right choice? Is this worth it? And then you go see a patient and you're like, absolutely. Like, there's no place I would rather be. I will take all the stress in the world. And then there's days where I'm looking at myself and I'm like, okay, I begged for this. I applied 5 times for this, and you can do this, and you just have to get back in it. So you have good days and you have bad days, but I think scribing really taught me the reality of it, of what I was getting myself into.
Well, you 3 stole my answers, but I think I got, one measly 4th edition. Scribing, for me, emphasized the importance of listening. Like, it's so critical to when you're a doctor and establishing that relationship with the patient, just being able to listen, catching everything that they're saying, and then things that they're not saying, how they're saying things. That'll make the most of the few minutes that you have. Some of the doctors, they would be in patient rooms for only 3 minutes. And so if you're able to listen and get everything you can, no matter how much time you're given, you'll be able to, take as much as you can from what the patient is offering you. It'll help you write more thorough HPIs, just the whole shebang, and you get that extra experience as a scribe. You're going to be given that experience in medical school. Even in your first year, second year, you're going to be doing that stuff, whether it's with standardized patients or the few encounters you'll have with real patients and shadowing doctors, and then especially 3rd and 4th year. But if you can have that 1 extra year of everyday hands-on listening, to 8 years, you'll be, way ahead.
Yeah, we've got a couple questions out there, and I'll just kind of throw some of these out there, and then we can kind of wrap up in a few minutes. But what did you guys learn anything about health insurance while you're scribing?
Yeah, I learned how, at least in the ER setting, it can become very easy to see your patient, diagnose, discharge home if possible, without thinking about the aftermath that comes with whatever you just diagnosed your patient with. Are they going to be able to afford medications? Are they going to be able to afford this visit? And especially the last 4 years, I worked at a county hospital, and we got to see a lot of uninsured patients. So not just, being more aware of the aftermath of your intervention and what effect it has on not just your patient, but their family. You get to see conditions that are long overdue. And sometimes it's terminal for the patient because it was delayed, because there wasn't any insurance coverage, or there were hurdles that weren't able to be overcome. So you get to see the ugly side of not being insured.
Mm-hmm. Yeah. I didn't get too much experience with it, but what little I saw, it was very interesting. to see the relationship between the doctor and the insurance companies. There was this negative relationship between the two. I could see that the doctor siding with the patient and then like editing the note, tweaking it a little bit because they feel like the way that they're writing the note or the way that the patient is presenting isn't going to be enough, even though the doctor knows it's enough. They deserve to, be treated. They see it firsthand. They can see the pain. They hear the pain in their voices, but the insurance companies don't, and so that tweaking that I witnessed, it was very interesting to see.
Mm-hmm. We got questions. Oh, go ahead, Melissa.
Oh, sorry. Just another addition to that, you get to see kind of the superfluous workups. You get to see I'm ordering an X-ray before a CT because insurance may or may not cover it unless you do the X-ray first. Things like that, or trying to go alternative routes just to get coverage for a more expensive procedure. So you get to see a lot of excess ordering, which is also pros and cons, but.
There's a couple questions out there about talking about your scribing experience in your application, your personal statement. How do you use it? What are some things to avoid? And I'll briefly touch on that a little bit, coming from being on the other side of things and being on the admissions committee and reading essays. And I will say, I don't recommend using your scribing experience in an essay to really try to describe a patient that you think was something so unusual or exciting. I've read so many essays where it starts off where it was like, it was 4 a.m. and a person came in coding and I jumped up and I did chest compressions and stuff. And even though that may seem really exciting for a pre-med, most doctors and, a lot of admissions committee members are physicians, they're reading that and they're like, codes suck. Nobody likes coding. Coding means somebody is dying, literally. This is not a fun thing. And this is something we have to deal with every day. So maybe it was unique to pre-med, but to a physician who's practicing, they're just like, this is not something we want to celebrate. We want to protect coding. We want to, recognize what a difficult experience it can be. So I see a lot of that, of people kind of writing about these experiences. I see a lot of people kind of just writing as if, their experiences with patients are unique. And I think there's value to that. But what I really love to see when people write about their scribing experience is showing off your strengths as a scribe. Like you guys were talking about earlier about how you didn't just go there, type on the computer for 8 hours and then leave home. No, you asked the physician, hey, I'm super interested in this patient. Can I stay on afterwards and see what happens to them? Do you mind if I watch this procedure? Having that collaboration from physicians where you're showing initiative, you're showing interest, enthusiasm, you're going the extra mile. Those are the things that I would love to see people write about in their personal statement and in their application about scribing. Not just the unique patient experience. Write about you and demonstrate those strengths that scribing emphasizes. I think that is so important, and I'd love to see that more often. I don't see that enough. Anybody else have any tidbits on personal statement or your application and how to kind of leverage your scribing experience?
Just to, expound on what I said, that scribing offered me that concrete experience to ground my essays. I'm a very just artsy kind of mind. I love when I go to write an essay, it ends up being a poem somehow. And I realized that wasn't going to cut it, I can't just have this ethereal... Yeah, exactly. And that's what I go for. And so I needed the scribing to ground that. I can start and talk about my experience, and that's who I am. So if it's a little poetic, then so be it. That's me. But as long as I can bring that back to a real experience or series of experiences, something to show them that I know what I'm talking about. I have worked in a clinic, in a hospital setting. I have spoken with doctors every day, every other day. I witness the doctor-patient interaction every day. I know what it should look like, what it shouldn't look like. Then that was a huge help for me.
I think one thing too, Melissa, you mentioned earlier is that idea of medicine being kind of romanticized. And, pre-meds, myself included, most often don't have a very good understanding of what medicine actually is. And I'm sure as you guys go on through your training, you'll realize, well, scribing helped me, but man, this is different being the actual practicing physician. Obviously, you don't know what it is exactly till you're actually in that role. But I think what's so valuable too about scribing is it kind of takes away from that romanticized idea. You're sitting there with a doctor who's maybe worked 4 12-hour shifts and they are tired, or this patient is driving them nuts and they want to get them out of their ER. I mean, it's not all about, every patient coming in, teaching us some wonderful lesson. And then we, reflect on how thankful we were for having that experience. It's not like that. I mean, not to say, medicine is bad or medicine is just way too hard, but it is hard. And there's not always good moments. Even that coding example I talked about, coding is terrible. That's not a fun experience. Even on TV, though, you see it as all exciting. People are racing around and they save the person. The truth is that doesn't really happen in real life. So I think that, like you said, Justin, kind of almost helps to ground you a little bit, gives you some more insight and perspective that usually people in going to be a physician aren't getting until like their 4th year of medical school, sometimes their intern year of residency.
Yeah, there was one very, very vivid memory that I have of a resident losing his first pediatric patient after attempting to resuscitate. And I was there and he came back and he was almost a little bit in shock. And the attending pulled him to the side and said, "You need to feel this." So he took him into an empty room and he just let him feel what it was to lose a life. I'm sure that resident had lost patients before, but this was his first pediatric patient that he wasn't able to resuscitate. And hearing that resident just cry, medicine is very raw. And if you're, when you're put in a situation where you're observing situations like that, it really gets you thinking, am I cut out for this? Am I going to be okay having difficult days and truly difficult days like this? And, I think that kind of preps you a little bit.
Yeah, absolutely. Thomas, do you have something to say?
Well, no, I was just going to say, but kind of also the other end of the doom and gloom. Like one thing that and this has been like really reassuring. Maybe it's just like in my medical school, the majority of the people we work with are kind of private practice, older physicians, and they are a cynical lot. Who one thing I'm very happy for my scribe time and is like, they said earlier, the doctors you don't want to be. I worked with a lot of doctors I do want to be. And it was a really good reminder that you can have this like positive, healthy career and this great relationship with medicine. And I mean, I would try and like work that into your essay somehow. Like, I love medicine. I've seen these examples and like have this passion and I see who I want to be. This is gonna sound silly. I see who I want to be when I grow up. And like here I am in my 3rd and 4th year and I've got all these attendings and a lot of them I don't want to be. And I might be questioning, hey, is medicine right for me if I hadn't worked with all these amazing physicians? And I'm like, yes, that's who I want to be. Both of the people who wrote my rec letters are people who were like, yes, this is the kind of doctor I want to be. This is like the future I see for myself. And so we've been like kind of negative here. And I want to like put the opposite end. Like scribing can really provide those positive mentors, those positive influences in your life. That, you can really focus on how do I want to mold myself? Because I've seen these great examples.
Yeah.
Absolutely.
Yeah, no, that's an absolutely completely valid point, and I think it is good to always remember the positive, but recognize the negative too. But no, I think that's great. You kind of see you learn from the people around you as you're becoming a physician, and you will take those people that you saw years ago as an undergrad, as a scribe, and be like, those are qualities I like. These are qualities I don't like. And soon you'll build yourself up into your own type of physician. And then hopefully, you'll have scribes come to your office one day and you can impart the same type of knowledge and experience to them. Coming up to 9:00 Eastern. So I just kind of want to wrap up a little bit. Everybody who's listening, thank you so much for joining us. You will get an email with the recording of this webinar if you want to refer to it again. Also, you'll get some email with a little bit about MedSchool. So if you guys are interested in talking to physicians like myself who have kind of gone through this path, walked this road, and now have been on the other side of the whole admission cycle and kind of seen what it takes from the admission standpoint to get into medical school, just hit us up. We would be happy to talk with you. We have tons of physicians that are just really wanting to become mentors, or really just love being mentors to applicants like yourselves out there. I would have loved to talk to all three of you guys when you were applying, because as you were saying earlier, I mean, you went through lots of hurdles, myself included. I applied one time, completely unprepared, didn't know what I was doing, but I thought very similar to you, Melissa. I'm like,
Yeah.
supposed to apply, and then I applied. I was like, I was dumb. And even when I did apply and was successful the next year, I still didn't have like all of my ducks in a row, but I got pretty fortunate. I was lucky that year. So, all those people out there that are uncertain about their application, how to make it stronger, what can they do to really put their best foot forward? Reach out to MedSchoolCoach. We're here to help you guys. As we wrap up here, I'm going to start with Melissa. What are your last kind of tidbits, any tips, thoughts for those people that are out there scribing, going into medical school, in medical school, thinking about medical school? What would you leave some of our listeners with tonight?
So I guess the biggest thing that has made a huge difference for me in med school is to stop comparing myself to other people. It is toxic. It does more harm than anything, at least for myself. You know what you have to do, and you know where your deficiencies are in your application. So address them. And if that means, having to delay a year, it's fine. That year will still go on, and whether you apply or not, and just try and do your best. I addressed my deficiencies, and I had a few in my application. For 2 years, I didn't have a day off, literally not a day off. But I knew what I had to do to improve. And I went from not getting interviews to receiving 2 PA interviews, and that was one of the PA years that I applied, and I received 3 med school interviews. So the other thing that I wanted to say is there will be more doubters than supporters in your corner. I had my academic advisor tell me, you will never get into medical school. And, you're having to take the MCAT more than once? Sorry, it's not going to happen. It went as far as my university declining to write me a committee letter to support my application because they just didn't believe in me. And so you better believe when I got my acceptance, I went to that office and I showed the man that told me that I would never get in. And I showed him my acceptance letter. And it's there. If you encounter rejection, use that anger and frustration and hurt or whatever emotion you have tied to it, use it to be proactive, to feed the resilience and feed the drive. And if you really want something, you'll make it happen.
That's awesome story. I can't wait to see you as a practicing physician one day. it's right at 9 o'clock. So, Thomas, Justin, any last closing thoughts?
I've got
You go.
something really quick, and that's do everything. Like, take a quick look at not just your application, but just like everything involved in going to med school, and make a list and talk to somebody outside, be that med school coach or something else. Full disclosure, I actually use them for my interview prep. I don't think they knew that when they signed me on, but anyway, have somebody look through your application and do it all. That's what got me in, is when I did literally everything from top to bottom. And that served me again in med school. Like, be that getting help for ADHD, for studying, be that working out, be that applying early, be that having the English department review your essays. Like, if it can be done, do it. And if you can't do it this year, get a setup where you can do it all and give it 100% on your application, because that's what's going to get you in.
Absolutely. I love that.
Mm-hmm.
Justin?
I would just say to remember the important things in life while you're going through this application process. I just remember studying for the MCAT and being so consumed by it and getting to a really anxious point, and then bottling that up and not sharing that with anybody, that was close to me. I don't know why. I just felt like I didn't want to worry anybody else with my own worry. And, that's not healthy. And it's already stressful going, like, applying and then even into medical school. And so just remember that this is one aspect of your life, that your life is made up of a bunch of other things. And that's what keeps me going through medical school right now. Like, being home, it makes it a little harder to study, but honestly, it keeps me more motivated. It gives me permission to just relax a little bit, to step back, to enjoy my family, all the other important things that make up who I am, and then go back to this refreshed, and the pre-med culture just throws all that aside in favor of medicine, like 24/7, it's only this, and it can't be, so.
Well, awesome. You guys, thank you so much for being on this panel. This was super helpful. I love hearing these experiences, and I'm so happy for each of you guys. I think you're going to make wonderful physicians. So thank you. Everybody out there, thank you so much for listening. Everybody stay safe.
Bye, everybody.
Bye.
Good night.
Bye. Thank you for having us.